So let me begin with a very, very quick introduction. I know that we're very excited to have Dr. Ravi Ramaswamy as our guest tonight. I've been working with Josh for a little over a year now, and whenever Josh talks about his recovery, Dr. Ramaswamy is one of those people that constantly comes up in terms of what he describes as a pillar of his recovery. We know that recovery is not simple. It's not a singular thing for most people. It's usually a combination of events and people that influence your life. But definitely, Dr. Ramaswamy is one of those people. So for those of you in the room that know Josh and enjoy the art that he creates, the fact that he's back creating, one of those reasons that he's back creating art is because of the good doctor. So with that said, because you have such a personal connection with the doctor, Josh, I am going to ask you to do a little introduction of him, and then we'll hear from the doctor.
Well, sure thing. It's almost impossible for me to overstate Dr. Ramaswamy's importance to me. I don't want to make him feel weird by saying this stuff with him right there, but I was at a point in time where there was a lot of people giving up on me, and rightfully so. I wasn't giving many people a reason to stick around, and the doctor found it. He told me at one point that I was worthwhile. And again, no one was really telling me that, but there's really a laundry list. It would take forever to kind of run down all of the kind of earmarked moments. But really what we're talking about is a doctor who still found enough time to be kind, to see that there was a person in there beyond the dope. And again, maybe we'll get into some of these stories later. I want to get to the doctor here, but I just cannot overstate his importance in my life and what his kindness and support really meant to me. And like I said, I didn't give really, not just him, anybody really many reasons to stick by me. So the people that did, they mean a great deal to me. Yeah, with that, I mean, I think you guys, Rob, I echo all your sentiments. You speak so beautifully, and then there's me. But I'd like to, well, and I also, hold on, one last thing. I do think it's important. We can get into some of the finer details of Suboxone. And this is part of, like, when me and Rob decided to do this, this is a big piece of what we're doing. I think there's a lot of questions around Suboxone. I think there's a lot of misunderstanding around Suboxone. I'm sure I'll have questions. Well, Dr. Ramaswamy spent years and years and years treating addicts with Suboxone and saving people's lives. And obviously one of those lives is mine. I don't mind saying my life would be wholesale different. I mean, let's be straight. I wouldn't be here. I'm 100% sure that I wouldn't be alive without Suboxone. And yeah, I guess with that, let's not waste this opportunity to ask some of those questions. And some of the questions I'm sure are going to be tough or deeply personal, or you'll be afraid to offend somebody. Don't be afraid to offend me. Do not be afraid to offend me. I want to hear all the questions. And yeah, with that, we open it up to Dr. Ramaswamy. I'm so thankful that you're here, Doc. You know I love you. You know I just think the world of you. And yeah, drop some science on our asses.
Okay. Well, thank you so much, Josh. It's a real pleasure to be here, and thank you for inviting me. You had put or given me too much credit for what happened with you. And I think the important thing for people to realize is that you had the courage to recognize the problem that you were having. You were willing to take steps to control that problem. And you complied with the treatment plan, and you took charge of your own health. So the only fifth part of it was me writing a prescription for you. So
no, hold on. I promised Rob I wasn't going to interrupt you, but no, Doc, come on. And I don't want to get you in trouble, but we can be honest here. There were times that I came in and peed dirty. I remember you telling me the next time this is out of my hands that you were bending the rules for me. And again, I think the statute of limitations is up. No one here is going to rat you out, but this was the moment for me that it became not really about just letting me down, that I didn't want to let you down. I had at least recognized, and I'll never interrupt you again after this, but this is so important to me. You bent the rules for me, because I know other people that got removed from the program, your program, for peeing dirty. And I did that. I showed up and I peed dirty, and you were like, one more time, and this is out of my hands. And I think that's around the time you said, can't you be smart for 30 seconds of the day? Can't you? And I believe it was when you said that, I don't remember exactly how you said it, but that I was worth it, that I was worth the treatment. I was worth getting better. And you made me feel worthy after I hadn't felt that. So when you say I'm giving you too much credit, maybe in a sense you're blind to just how much that meant to me. And sometimes things get clear in the aftermath too. It took a long time for some clarity to land, and really, but that was the boat. That was what got me to take my care a little bit more seriously, because clearly I wasn't taking it seriously. I'm showing up there peeing dirty. I'm showing up there with drugs in my system. That's not someone taking their care. I took it seriously. Yes, because of the other things in my life, and partly because of your belief. I will not interrupt you again. I just had to say that.
Okay, well, your point is well taken. And I think what you said was very important. It's the clarity. Now, you gave a dirty urine, those things are part of the territory of the treatment of addiction and dependency, because addiction is a very complex situation. It's not like someone takes this drug or that drug and gets addicted and does all kinds of things to get the drugs or get obsessed with drug usage. It's a very complicated issue. The thinking has changed over the years. In the old days, 1930s, 1940s, when AA used to be in vogue, I mean, they started then, and they were mainly dealing with people with alcohol use disorder. The principle there was abstinence, that you needed to just abstain from it and find other ways to occupy your mind. Though that thinking has changed over the years, and that is why they now have medical assisted treatment, or MAT, and Suboxone and methadone and all of that are medically assisted treatment. And so there are people that kind of say, hey, you're not just substituting one medication for another. But that is not true at all. Yes, something is being substituted, but the consequences of the substitution is much better, with a much better end result, as opposed to the former. So the thinking has changed, and there are even medical providers that think the same way, that you're substituting one for the other, so what's the point? And as a matter of fact, talking about providers, many providers, if not most providers, don't really dabble in addiction treatment. They just don't want it part of their practice. In the old days, the DEA used to require physicians take special training to prescribe Suboxone. And of all the people that got certified in Suboxone, at least 90% of those physicians and providers did not want to treat Suboxone patients or prescribe Suboxone. And so there is a stigma, not just in society, but also in the medical profession, to treat opioid use disorders. So I, years ago, used to be the medical director of a short detox program in the hospital as an inpatient. That's what got me to Suboxone, because I was seeing these people who were being admitted, were given 5 days of detox, and then they were discharged with no way to go or nowhere to go. And then they used to relapse because there was no structure in their discharge. They said, okay, we are going to refer you to the methadone clinic, or find your own way, go to Narcotics Anonymous and figure out a way to get off it, which was very ineffective and resulted in massive failures. So then Suboxone came along, Methadone was the only medical assisted treatment up to that point. And methadone is highly regulated. You got to go to the methadone clinic, and we all know what happens there. People sell their methadone, and a lot of things happen. Prior to that, I think it was probably in the 60s, methadone used to be allowed to be prescribed by physician providers. But then it became a racket. There were so many physicians. I think there was one group in Washington, D.C., I think, who used to have armed guards outside their office, and they used to dispense methadone on a cash-only basis. It became a real bad situation when the government had to step in, DEA had to step in, and they took over the methadone program. So now methadone is very highly regulated and only available in the methadone clinic with a long waiting list. So that's where Suboxone came in. Suboxone, also known as buprenorphine, is a medication which the DEA said could be prescribed by providers as an outpatient in their offices. And so that's how I got interested in Suboxone. I got certified. The DEA only allowed you to treat 30 patients in the beginning, and this was just before the opioid epidemic. And then after you treated 30 people for about a year, they increased the quota to 100, and then finally the highest was 275, which I was allowed to treat 275 patients. These days, the DEA has kind of gone away from that special certification for Suboxone because they want more providers to be able to prescribe Suboxone even without them getting certified. So it was, I think, 2 years ago that the DEA kind of waived the requirements to have certification. But even then, at least 80% of providers do not prescribe Suboxone, and they don't even want to see people with addiction in their practices. So it didn't really help matters. Coming back to this question of addiction, the thinking has changed about addiction. In the past, it was like, it's your fault. You have to pay a price for it. Nobody asked you to do drugs. Now you did it. So you're on your own. But the thinking has changed. Addiction is now believed to be a medical condition. It's not like a psychiatric condition. There may be some psychological issues also in play, but it's primarily a medical condition, a chronic medical condition that can be due to a variety of reasons. It can be genetic, maybe there is a family history of drug usage or alcoholism, or it may be changes in the brain caused by habitual drug use that causes chemical changes in the brain that then creates this ongoing process of addiction and dependency. So since the whole algorithm changed in terms of describing what addiction is, like somebody has high blood pressure, it's a chronic medical condition. Somebody has diabetes, it's a chronic medical condition. Somebody has asthma, it's a chronic medical condition. So addiction also has fallen in that category of chronic medical conditions, and hence medical assisted treatment is something that has got a lot of attention and a lot of interest among researchers, psychiatrists, and addiction medicine specialists. Now, I'm also board certified in addiction medicine, so I've seen things evolve over the years. And then we had this opioid crisis in the 90s and in the 2000s. Which kind of gave pain medications a bad name. Pain medications were used for treating pain. And now, just like the providers shying away from Suboxone, most providers now shy away from opioids. And there are people that genuinely require it for pain who are being deprived of these medications. And it's kind of become the flavor of the season to kind of bash opioids and opioid manufacturers and all of that. And yes, mistakes were made, and there were inappropriate prescriptions, but opioids are actually, quite honestly, taken responsibly, actually safer than ibuprofen. Much easier on the body, it's much safer to use. But I'm not advocating opioid use here, but I'm just trying to describe the whole process of that. So when the opioid crisis started happening, there were lots of overdoses. There were a lot of people that were getting opioids. The drug dealers, their marketing strategy was start people on opioids. And then when it gets too expensive, I think the price of opioids is about $1 a milligram on the street. So if you're taking 10 milligrams of oxy, it's $10. And if you start escalating the dose, you end up with a $100 a day habit. So that is the that is the modus operandi of the drug dealers. What they do is let's hook them off. It's very simple to give somebody a pill and say, hey, take this pill, you'll feel good. And then down the road, they kind of say, hey, you're spending $100 a day. Hey, for $50, I can sell you heroin. And so they transition to heroin that way. Now, why do opioids make people feel good? It's because of the effect on the brain receptors. Opioids, they affect the pleasure centers in the brain. They increase serotonin, which causes depression. They help with ADD. And by the way, ADD is one of the most undiagnosed conditions. And a lot of people in my practice had undiagnosed ADD, which is why they first dabbled in opioids, because the opioids made them feel normal again. They were able to focus, and they were able to do things well at work and at home. So opioids also affect certain receptors in the brain. They're called mu receptors, and are also pain receptors in the brain. And overall, it's a feel-good drug, opioids, because it affects various, it increases dopamine. Dopamine is the happy chemical in the brain. And a lot of things change. People that are depressed feel less depressed. People that, as I mentioned, have ADD have better focus. People that are anxious, it's an anti-anxiety medication. It affects various centers in the brain. And Suboxone essentially mimics opioids, and that's how Suboxone works. Suboxone is a partial opioid agonist. So what it means is that it partially goes and occupies the receptors in the brain that the opioids do. So you get that satisfaction that opioids give you by just taking the buprenorphine, because it affects those areas of the body. You know, Suboxone also has naloxone, which is an opioid antagonist. It's an opioid blocker. So it prevents the buprenorphine from making you feel high. That's the first thing. And the second thing is, if you were to inject Suboxone, it doesn't make you high because it doesn't give you any euphoria. So that's how Suboxone works. And then Suboxone, when we do give people Suboxone, we want to make sure they're in withdrawal so that there is enough vacant spots in the brain receptors that the Suboxone can go and occupy. It's almost like an advancing army and a retreating army. You know, the advancing army is well advised to wait till the retreating army has gone several miles away before they advance. Because if they don't do that, there are going to be skirmishes. The retreating army is going to turn around and fire at the advancing army, and so on. So that's the reason when we start Suboxone, we want people to be in as much withdrawal as possible. if they still have some of the offending drug in their system, you're going to have a withdrawal reaction. So when I used to have people come in, I tell them, don't take anything and then come into the office, and then you're going to be in withdrawal. I want you to be in withdrawal when you come in. And then by the time they see me, they get the prescription, go to the pharmacy, get the medication, go home. You're still having that army retreat even further. And so when you have that withdrawal starting, that's when you take the Suboxone to occupy the receptors, and then you continue the dosage. The army is retreating even further. The drugs are out of your system, and the Suboxone starts to work. So I've been, I would say, very successful in trusting my patients, in the sense that in a lot of clinics, they make you come there, they make you wait, they make you take the first dose of Suboxone, you got to stay there for an hour, and then you come back the next day, have another Suboxone, they drug test you and make sure. So everybody has their own protocol, but I based it on trust of my patients. People were coming to me because they, like Josh, realized they had a problem. They wanted something to be done about it to help them out. Their lives were in a mess. Their home life was in a mess. Their work was in a mess. They were in a financial mess because of their drug habits. And what this does, there is that degree of trust. They trusted me to help them, and I trusted them to take charge of their health. So I used to just say, hey, take a week's prescription, go home, go into withdrawal, take the medicine, come back and see me in 1 week, and then we will adjust the dosage if needed. And then I used to give them a 30-day supply, so that they could have it for the whole month without having to come back and me cross-checking with them, etc. And yes, we used to do random drug testing, and I can tell you that 99% of my patients were, occasionally they had dirty urines, but for the most part, they were very compliant. And I was more concerned about, I wasn't concerned that they were smoking marijuana. That wasn't important to me. My main goal was that they take their Suboxone and they're compliant with their Suboxone, because that would make a difference in their lives. So I used to check mainly to make sure that the Suboxone was in their urine. I also used to do a special forensic test, which actually measured the metabolite of Suboxone. And it's called norbuprenorphine. And what it is that, if somebody, the day before they come, they take a Suboxone to get a positive urine, the norbuprenorphine does not show up in the urine. So norbuprenorphine means that they have been chronically taking the Suboxone. So that's all I was interested in, is to see if they had the norbuprenorphine. And like I said, 99.9% of my patients had that. That's all I was interested in. And if they had any other things showing up in the urine, then we used to have a talk and chat and try to explain to them and make them understand the reason we were checking it. We were not checking it just to say, gotcha. We were checking it just to make sure that they were compliant with their treatment. And so, one of the most satisfying parts of my practice, and I see patients with different illnesses and other problems, but the most satisfying part of my practice has been the treatment with Suboxone on patients. And the reason for that is that it's transformative. It makes a huge difference in people's life, as Josh would attest to. But in everybody, whether they're a truck driver, whether they're a factory worker, whether they're an office worker, when they come back, there is a palpable change in their demeanor, in their attitude, in their joy. I had one young lady come to me a month later and said, you know what? I went to the mall with my friends. And, going to the mall with friends seems to be a very simplistic thing. but she hadn't done that in years. And that was a change back to normalcy. And, I congratulated her. I said, it's great. You're going to the mall. I hope you had a good time. And she said, wow, I didn't know how much fun I had missed all these years. And it was great. So, and there was somebody else that, started going fishing with her son. I can give you multiple stories, but the thing is, it's a trip back to normalcy. And from where the addicts were pre-Suboxone to where they ended up after they started medical assisted treatment, it's a phenomenal change. And that is what makes it satisfying for me to see. If I see somebody with high blood pressure, next time they come, their blood pressure is normal. That's all I can see from that experience. And the patients, they may not feel any different. The blood pressure is 140 over 90 or 120 or 80. Their life goes on. They don't feel any difference. But Suboxone makes a huge difference in their lives, in their personal lives, in their professional lives, in life in general. And that is what really struck me as something that was very enormous and really magnificent, that I feel that is what I went into medicine for, to help people. But am I really helping people? But in the case of Suboxone, I truly believed I was helping them. But again, as I was telling Josh when we first started, I was just writing the prescription and maybe giving them some words of encouragement when they came to see me. But it was them, such as Josh, who recognized that they had a problem, sought help for the problem, complied with treatment, and then said, okay, I'm going to take charge of my health. And the proverbial, the body is a temple and do not desecrate it. And they were back to worshiping their body. So that's all I have to say, Josh. And thank you for having me here again.
Okay, well, okay. There's a lot in there as I got my notes here. I got a lot on here. So the first thing, Suboxone, it's a really like a hot button issue, right? There's a lot of people that pass, and you know what? I would imagine that some of them are in here. So get your dukes up, Doc. I'm sure there are going to be some questions getting fired at you, but this is where I felt like a call to action. With all these deaths, with all friends of mine that have dropped dead, I didn't want to stay silent about how I changed my life and how I'm not just alive, but really thriving, and not just professionally, but really personally. I don't know that even pre-opiate abuse that I looked in the mirror and really liked myself. And that's really the truth, I think. And I'm not giving Suboxone all the credit for that, but it allowed me to focus on my life in a way. My focus was heroin for so long that it allowed me to grow, as people do. Like, if we're not thinking about drugs all the time, then we get the chance to grow. So in a roundabout way, I guess I do kind of credit Suboxone with that. But in terms of like the stigma attached, how do you as a doctor, or do you even have to combat that? Do you ever get patients that come in and say like, oh, that's just one drug for another? Because I can't tell you how much I hear that. And I'm just of the mindset that maybe with all of the people's, whether their lives are in shambles or that are dying, with all the people that are dying, that maybe we shouldn't be cutting down somebody who's in medically assisted treatment and found a way to merely stay alive. Do you in your professional life, do you have to combat that stigma? Is the question I'm asking.
Again, there is a lot of information and misinformation about Suboxone. There is that, in fact, Donald Trump's first Surgeon General, who was an orthopedist from Atlanta, he even remarked that, addiction, that was at the height of the opioid crisis. And he said, this is just one drug substituting another drug. And he got a severe backlash from the American Society of Addiction Medicine, from AMA, saying that, hey, you're sending us back 50 years. with that statement of yours. And this is the Surgeon General, the top doctor of the USA, making that statement. So I don't really blame people who think that there is a substitution of one drug for the other. But in addiction medicine, and especially now, as I mentioned, treatment. Take, for example, cigarette smoking. You can slap on the patches or take the Chantix or the chewing gum, the nicotine gum. That is substituting one nicotine for another. However, there is a huge difference. You're not inhaling all that coal tar. You're not doing all that. And the amount of nicotine that goes in your blood fluctuates when you smoke, because you're taking a deep drag or you would take a shallow drag. So the levels of nicotine fluctuate in a big way. And that is the reason why people have a tough time quitting smoking. Whereas if you put them on a nicotine patch, they get a very smooth, modulated amount of nicotine, which then calms down the nicotine receptors, and then you can slowly take them off the patches. So in the same way, there are treatment for alcohol use disorders, where you give, for example, there's a medication called Vivitrol or naltrexone injections that are given once a month. And that is also a medically assisted treatment, a sort of substitution. So yes, it is one for the other, but the consequences of opioid addiction and dependency and overdose far outweigh the risk of another medication that is used as a substitute. And not only that, you're giving it in a controlled manner. You're just taking a pill like you would take a pill for your high blood pressure, or take an inhaler for your asthma. It's just being, it's really to normalize the chemicals in your brain. It's like taking an antidepressant, SSRI. If somebody has SSRI issues, they get depression, you give them an antidepressant. And yes, there are people, for example, the Church of Scientology, especially, and Tom Cruise, for example, has said that antidepressants are rubbish. Nobody should be taking it. In fact, a few years ago, he had an argument with, I think it was Brooke Shields, who had a problem with, I think it was postpartum depression, and he was criticizing her. So sometimes, and in the old days, things like depression and anxiety were considered weakness in a person. And it's no longer considered that. It's considered a chemical issue. And so some of these medications to neutralize or normalize your serotonin levels is also a substitution. So we do that all the time. There are people that do not believe in it. There are people that may argue against it, but it is very effective, and it is relatively safe. And it, like I said, it makes a huge difference in people's lives.
It's like, again, we can't overstate. My life is wholesale unrecognizable to the kid that every waking thought was centered around heroin, how to get it, who to rob to get it, how to take advantage of people to make sure I wasn't sick that day. And that, again, that's why I'm putting myself out there. So that leads me to my next question. And I hope there's some questions in the audience here, because I'm really curious what the people in here want to ask you. But what do you say to someone who's kind of gamed the system? I say gamed the system. They went and got a Suboxone script, and they weren't. Now, I know a person in my life that had no business on Suboxone. They had taken a few Vicodins in their life and recognized that it was like a fun thing to do, and went to their doctor and just kind of made up that they had an opiate problem, and got it, much to my surprise, got a Suboxone script and started taking Suboxone. And they're really out there beating the drum of how bad and addictive Suboxone is. And I just want to really, I love this person, but man, do I want to wring their neck sometimes and just say, you had no business on Suboxone to begin with. Suboxone is for hardcore opiate addicts. It was never for you. I'm sure it was addictive. I mean, is that something that you're seeing happening a lot? Is that something that's coming down the pipeline a lot?
Yeah. Suboxone has other properties too. It's also a painkiller. It's used in even now a variation of buprenorphine is used for treatment of pain. And I also had one patient who was on opioids for pain, and then I persuaded him to switch to Suboxone, and he took the Suboxone, and it took care of his pain as well. There are several properties of Suboxone and buprenorphine. Yes, there are people that game the system, and some of them will game the system no matter what. Sure. And I think it's important for the provider that he sees to carefully monitor him. And sometimes it's very difficult. There is no test for addiction. Okay, yeah. There is no test. I cannot, the person walking down the road, he may be an addict, but I would never know that. And there is no blood test. I mean, yes, certainly you can do a drug screen and find out whether they actually are using it. But on the other hand, when they come to see their provider, 9 out of 10, or probably 9.5 out of 10 times, they're coming because they genuinely need the medication. But gaming the system, yeah, there are people that game the system.
Yeah, I guess it's just, this was also years ago. He's been off Suboxone for a long time, but he always chimes in about just how addictive it is. And I always just, well, I do say to him, I said, dude, you weren't supposed to be on it anyway. But it's funny to me. I do feel, I have a lot of friends that got clean the old fashioned way. And I'd be, in the interest of like full disclosure here and hoping there's some honesty and something good that we can dredge up from this, but I do feel a sense of shame sometimes, failure on my end, that I just wasn't able to get clean the old fashioned way. And I do encounter that a lot. And I just try to be open and honest about it. I needed help. I had invited something in that was so all encompassing, so dark, and just, I knew it was going to kill me and I needed some help. And I guess, I mean, I don't feel like I should be all that ashamed of needing some help. Again, like my life and me is unrecognizable to that, to the active addict me. But I do feel that shame. How do you combat that in terms of your patients and some of that shame that they may feel? That might seem like really kind of antiquated to you, Doc, but that's a real reality for me. I mean, it's almost, even embarrassing, at times, if I've got to go to a different doctor and got to list the medications I'm on. I always feel like a hint of shame. And you know what? Every time I say that, they tell me, people in the medical world, don't ever feel shame for that. And they're very uplifting and very encouraging. But just in the regular world, I mean, I have friends, people I care about in my life that probably feel a certain type of way about it, but I needed help. This thing was going to take my life. I was not a low-level junkie. It was, like I said, all encompassing. It had me by the throat. It had infected everything good in my life. And I needed some help. How do you combat patients that might feel that shame?
Well, the fact is that, people do feel bad that they went in a certain direction. So it's not that they have been failures. It's just that they chose a path that ended up in self-destruction. And there could be several reasons for that. Okay. Like I said, for example, that undiagnosed ADD person suddenly takes an opioid and he suddenly feels normal. Or somebody that has pain, they had a neck issue or a back issue and they take the opioids and they feel great. And like any addiction, you have this feeling that if one is good, two is better, and three is really going to be great. It's the only problem is that the body gets used to it, and you start escalating the dose because of resistance. So when I see patients where there is some indication that they're feeling really bad about themselves and what did I do, and as you well know, people go to great lengths to get that money, and especially among women, unfortunately, the reality of the situation is they may have to do all kinds of things to get that money. And that is the reality of the process. That's the nature of the beast. But ultimately, I think I try to be positive in the fact that, hey, you finally have come and are seeking help, and you're going to get you back. Just look at, remember that girl that went to the mall, back to normal. And whatever happened in the past happened because of various circumstances. That doesn't mean that you are a failure, that you need to feel ashamed of the fact that you are now coming to seek help for a condition that you wished you never were involved in. So I think there is a degree of, I think most drug addicts would rather not be drug addicts. And they, at some point in their lives, are in a situation they're bottled in with nowhere to go. And they feel it's the end of the line, and they feel they have really no way of getting back to normal. And that, once again, that's where the Suboxone comes in.
Yeah, but I just want to make sure I'm ultra clear. What about shame about taking Suboxone?
Okay.
Person A didn't clean up the old fashioned way. They were too weak to do it. You needed help doing it. Do you ever encounter that?
I think most people that used to come to me, they were beyond that stage. They really felt that, okay, I cannot do this by myself. I need some help. And so I think there are people that say, I want to do it the old-fashioned way, like I mentioned, like what they do with Alcoholic Anonymous. It's really abstinence. There is nothing, you got to be off it and find other ways to distract yourself. But there are people that say, I'm going to do it the old-fashioned way. And I say, okay, fine. Go ahead, give it a try. And if for some reason you're not able to do it, you can always count on me.
Well, that was me, Doc. I had tried. I wanted it with all of my heart and failed. And it only kind of reinforces the self-hate, reinforces the feelings of shame and failure. This version of me sometimes encounter people that look down on you for taking Suboxone. That is a reality for me. And that's what I mean with, I'm willing to take my lumps and say, hey, I needed some help. I'm not trying to not be ashamed of that. If it was such a walk in the park to get clean with Suboxone, well, we wouldn't have addicts all over the place and be dealing with
and you're brave. You're brave to admit that you're on Suboxone. You're brave to have this
brave or stupid, one of them,
to help other people and exposing yourself. A lot of people, they don't even tell people they're on Suboxone, and that's one of the beauties of Suboxone, is that you can go to your doctor's office. Nobody knows what you're there for. If you go to the methadone clinic, everybody knows why you're there. Whereas in a provider's office, you may be there for your blood pressure. Nobody knows. And it's only when you meet the doctor that the Suboxone issue comes up.
Well, that was the story of my life. For years, I did hide it. I didn't want anyone to know until enough people died. And I said, man, dude, I'm sure this family that lost their son or daughter would trade having them here taking a Suboxone every morning as opposed to having them in the ground. Or I could save people by saying, like, hey, let's combat this stigma. But it is scary, man. This is a scary thing we're doing. I've already taken some lumps, and I'm a sensitive guy. I'm not good at taking lumps, so I better get tougher. I'm trying. I'm working on it. I hear Rob laughing. All right. Well, I could probably ask you questions this whole time. I'm really, God, this is such an opportunity to have Dr. Ramaswamy here. It really is. So I hope do we have some questions?
Yeah, we've actually, I want to ask one myself before we transition into people asking
Terrific.
questions. And we've got, I just want to remind people that we've already got a couple of questions in the chat. And we'll ask for you if you're not wanting to ask yourself on screen or ask the doctor directly. If you have a question for the doctor, just put in the chat, say, hey, please ask for me, and then give me the question and we'll pass it along. If you do want to ask a question directly, please hit the raised hand button, which is part of the reaction menu in Zoom, and we'll get to you in the order that we do. And I've already seen a couple of good questions in the chat. I think we've got really interesting stuff coming up. But let me transition by asking a question of my own, doctor. Either in the literature or in your own practice, in your experience, what's the percentage of success versus failure with Suboxone? And what separates somebody like Josh, who was successfully followed a path of recovery, versus somebody that doesn't?
Well, I think the success rate really depends on the relationship between the provider and the person coming in for help. And there are a lot of clinics everywhere where they just go in, you pay some money, they give you the Suboxone, and you're there. And then you go out, you come back the next day. So Suboxone, the people that really come in are motivated, much like Josh. They come in because they're at the end of the line. They don't know what to do. Their drug habits are getting to be very expensive. They're getting all contaminated drugs, and there are people dying around them. Friends of them are overdosing. So when they really get motivated to come for help, I think the success rate is probably close to 100%.
Wow.
In my practice, almost everybody that I treated with Suboxone continued to come in for Suboxone. I did not have anybody that dropped out unless they were moving out of town. The success rate was quite impressive. And also it depends on the person. The person needs to be committed to getting better. In other words, take charge of their health. And under those circumstances, they are bound for success. And you also have to remember that people have bad memories of what they had to go through during the addictive process. And then all of a sudden, they get on, for example, on Suboxone, and their lives are completely changed for the better. And then they say, do I have to go to those dark areas in my life again? And that itself is a motivating factor. And then they find, like that girl that went to the mall, things have become normal, and things are getting better in their lives. So they don't want to go back and revisit those dark spaces. So the success rate is pretty high.
And Rob, I just want to briefly say, do you remember when in one of our interviews where I talked about watching a movie and saying to myself, holy shit, I'm enjoying watching a movie. Like that was just like the girl going to the mall. It was a revelation to me. I hadn't enjoyed watching a movie because everything I had loved went by the wayside. The story of the Mets in the playoffs, and I didn't even know. That was a real eye-opening moment to me. I mean, I'm a die-hard Mets fan. I didn't even know they were in the playoffs because drugs. That's what I knew. I knew drugs. The Mets are in the playoffs, and then fast forward to on Suboxone, much like the girl who went to the mall, something so like seemingly simple, but she enjoyed it. I really feel that story. I know exactly what she meant And for me, it was watching a movie and slowly starting, I'm always late to the party. It took me, I always say, a year. I remember, to be perfectly honest, Doc, I remember kind of planning on using drugs again while on Suboxone. That first year, I had fully planned. And I'm only honest about that in hopes that it can help somebody to hear that. I was at the end of the road. My life was unmanageable. There were people after me, bad people, people capable of hurting you severely or really, quite honestly, murder, that were after me. I owed money. Everything was out of control. But I had just gone on Suboxone to kind of get people off my back. But this is what I mean. I'm late to the party. When I had a real year, that was the moment of clarity for me. And I said, maybe I'll give it another year. And 2 became 3, became 4. And now I, am the beautiful flower that has bloomed that you see before you. But that first year, things were so unmanageable. I was willing to go on Suboxone, but my own hard-headedness and stubbornness, I had planned on doing drugs again. It was really, and again, I don't mean to make you feel uncomfortable. I think it was the talks that we had, the faith that you had. I didn't want to let Tammy down, my wife, Tamara, who is every bit responsible as you for really saving my life. And I give myself some credit too. My 92-year-old grandmother loves to give all of the credit to Tammy. It's like I did nothing, but I give myself some credit in here too. But I didn't want to let these people down, and slowly started to build a foundation of myself again. And Suboxone was such a big piece of that. And some people want to take chunks of me, want to take bites at me for that, and that's okay. But when the options are dead or in jail or a life that's not worth living, or taking Suboxone and putting together this life where I like myself and I want to do good in the world, I like myself. What kind of choice is that? It's a no-brainer, right? But so if people want to take stabs at me for being on Suboxone, that's okay. I do envy the people that cleaned up the old-fashioned way. You have my undying respect. And I have my best friend in the world cleaned up that way. And he's never judged me, and I give him a lot of credit for that. Him and his wife were both severe addicts, heroin addicts. They changed their whole lives. They did it the old-fashioned way. And I respect the hell out of them. I wanted that too. I just I didn't do it. I did it a different way, but we kind of got to the same place, and we all enjoy our lives, and I love them so much. They put together such a beautiful life with such a beautiful family. I don't know if they're in here. They come into these meetings sometimes. So Barry, if you're in here, he'll make fun of me for saying all this, but okay. Yeah. Let's get to some of those questions, man.
All right.
I'm really
I want
interested.
to, by the way, as kind of a transition to one of the questions, I have to tell the doctor, one of these days I'm going to have to get you to watch Josh on stage when he talks about his recovery and his relationship with you, because one of my favorite things is when he tells everybody that you kind of challenged him and said, "Look, I know you can't be smart all day. Just be smart 30 seconds a day."
I don't know that he said, I
Um,
know you can't be smart. He said, can't
I
you
have
be
it on tape,
smart for
sir.
30 seconds? Yeah. Oh, shit. I might have taken some artistic freedoms with that, but he said, can't you be smart for 30 seconds a day? Meaning just take it, because I was flip-flopping back and forth. I was still using drugs. I was not doing the program. And I think the faith the doctor had meant more to me. By the way, I had tried other Suboxone programs with other doctors. I came to Ramaswamy as a Suboxone failure. I'd also tried methadone. I'd been to rehab after rehab. I mean, I wanted this to end. I just didn't. I mean, try to imagine you're sitting there and probably undiagnosed ADD. Everyone in the world tells me I have ADD, but I've never been diagnosed. But forget that. The air has a flavor and it ain't pleasant. You showering, the water hurts your body. Everything is awful. And just 100 feet down is a guy with a powder in his pocket that doesn't just take it all away. It takes you from the worst you've ever felt to like the best you've ever felt. And that's your everyday. And I think most junkies are saying to themselves, let me just get right this one last time, and then I'm going to figure it out. I'm going to make this right. And before you know it, years have gone by. Years have gone by where you say, I'm going to make this right. And I finally end up at a Suboxone doctor, and it was one of the places like Dr. Ramaswamy was talking about. It was cold. I was in desperate need of some kindness. And I get it, man. I do understand at some of these rehabs and some of these places, they see so much failure. They are cold, but I'm such a sensitive person. I'm such a baby. I needed some kindness and maybe a little bit of faith. And the first doctor I saw, it didn't last long. He kicked me right off. There was like kind of no understanding. And I found myself at Dr. Ramaswamy after like hundreds of failed attempts. So it's not like I just said, you know what? Dr. Ramaswamy's a doctor. He's like a very clinical way of describing these things. But like, it wasn't like, oh, I'm taking my health seriously today. No, I came in there a broken person. And I probably had shed some tears in his office. I wouldn't be surprised. And I was desperate for a little bit of kindness and a lot of help. And he can try to kind of water it down as much as he wants. That these were enormous factors. These without Dr. Ramaswamy, I'd love to say I think I get there. I don't see it. I don't see it without. I tried with other Suboxone doctors and failed. I tried at methadone clinics. They gave a junkie a script of methadone. It lasted 18 hours. You get high as shit on methadone. I was like, oh, I love methadone. It's great. As I'm just taking it nonstop, and got me and my buddies high for a night. And that was about it. That was my methadone experience. Got kicked right off. But yeah, let's get into the questions. Let me shut up.
Okay.
And I'm really curious to hear some of the questions.
We got a couple of questions from the chat. And Will, I see your hand up. We're going to get you third in line. The first one comes from somebody in the chat, and you'll have to forgive me if I mispronounce any names of things here. But the question is this. Sublocade has become big with MAT programs. Thoughts on this injection versus the sublingual film?
Good question.
Well, the mechanism of action as well as the chemical ingredients are very similar. It's just the convenience of having the convenience of administration. The injectable ones, you can do it less frequently. You don't have to take a pill or a film every day. I think from a psychological standpoint, taking a film or a pill every day kind of simulates taking, let's say, an oxy every day. So there is some subconscious alignment to that. But yeah, Sublocade is a good medication. It's also used due to convenience by providers as well as addiction clinics. But does it offer a major advantage over Suboxone? It's the same medication. It's just the method of administration and frequency that is different.
Okay. Thank you so much. The next one actually comes from overseas, Doc. And the question is, it starts with a statement. It says, meth is huge here in New Zealand at the moment. Are there similar treatment options for amphetamines and similar drugs?
Yeah. So in the context of Suboxone is not used for anything but opioids. It can be used for hydrocodone, opioids, heroin, fentanyl, all of that. With meth and methamphetamines, the treatment is, there is no medication-assisted treatment for meth addiction. It's more in terms, and in fact, I was at an addiction medicine conference not too long ago, where they were talking about crystal meth and methamphetamine addiction. The problem with crystal meth is that it is a medication. It is like cocaine on steroids, so to speak. So cocaine is a very dopamine agonist. Dopamine, as I mentioned earlier, is the happy chemical in your brain. And the more dopamine you secrete, you get more energetic, more happier. And crystal methamphetamine is, as I mentioned, cocaine on steroids. So it has such a tremendous influence on the dopamine system and creates such a big surge that there is no comparable medication that can provide such a surge. So you're going to be less satisfied. For example, there's an antidepressant called Wellbutrin or bupropion, which is a dopamine agonist, which works by helping depression by increasing the dopamine. That produces like a fraction of the dopamine surge that cocaine produces. And of course, crystal meth is far removed in terms of the amount. So it's very difficult to have a dopamine substitute for crystal meth. So it's going to be more in terms of therapy, more of cognitive behavioral therapy, making people understand the consequences of that. You know, you lose your teeth, you have all these different medical manifestations of that. And so, again, there may be some underlying medical issues like depression or anxiety or even ADD. And, some of these things can be managed psychologically with therapy as well as with medications. But with crystal meth and metham, because of the way they make the dopamine really blossom out in a tremendous manner, medications that mimic that are not that effective.
Okay, thank you. We have Will, who has his hand up. We're going to let Will ask the next question.
Yes, sir. I was just curious, kind of got my answer from Josh's story earlier, but is the Suboxone's a pretty long-term commitment, right? Is it something you ever recommend weaning yourself off of in the future? Are there patients that do better on it than others where you lower their dosage or raise the dosage? I was curious on how that is controlled.
To give an example, when I graduated from 30 to 100 patients that I was allowed to do, there was always room for new patients in my practice. And the reason for that is that there were people that were able to get off the Suboxone. So yes, it is definitely possible to get off Suboxone after they've been on it for a while. If some of the other circumstances surrounding their drug use is also being stabilized. And people have gotten off the Suboxone. I've had patients that have tapered off the Suboxone. But on the other hand, again, it acts also for long-term purposes. People don't want to get off the Suboxone because they fear the alternative. They don't want to be in a situation where they are without the security blanket. And they fear, oh, if I don't have the Suboxone, I may end up using. And so it's their choice of saying, okay, I'm taking one pill a day. I'm fine with that. I just want to continue with that. It's made a tremendous difference in my life. I don't want to go back and to those dark areas in my life. So from that aspect, it tends to be a long-term, really out of choice, not out of need, because people can taper off the Suboxone and people have tapered off the Suboxone.
Yeah, first, great question, Will. Really fantastic question. And I just want to briefly interject. There was maybe a couple years ago, I started floating the idea around my family of going off Suboxone. And I really got like a firsthand lesson in just how much I scared my family and just how much shit I put them through. Because everybody was kind of the mindset, why are we messing with something that's not broken here? And I'm okay with that. I feel like I would never ever do drugs again. But I would be lying, you guys, if I said I wasn't afraid of there's a lyric in the Weird Science song, Steady Straight Lights, Sudden Dark Turns, where I say, if that switch gets flicked, I'll drag all you motherfuckers back to hell with me. because I am afraid. I'm afraid to wake up and be that joyless shell of myself who needs a drug to round out every edge. I mean, I'm on like a quarter of my starting Suboxone dose, but like, I don't know. I am okay. There are so many times that I forget to take my Suboxone. And this is to me like the most clear example of how different it is from a drug. I've never taken it at night. Not once in my life have I ever taken a Suboxone at night. I just wait till the next morning. It's usually like around 8 o'clock at night that oh shit, I didn't take a Suboxone today. Like I woke up and had to get rocking right away and get moving. With drugs, no junkie's weekend stash ever made it past Saturday afternoon. I mean, you'd have your weekend stash and you'd use it all. It's use constantly. So this to me is like a clear representation of just how different it is. I don't think of Suboxone. I don't really think about it. I just take it in the morning and I go on with my day. Certainly don't feel like people around me think I'm high. I'm not like falling asleep on myself. You know, I just like anybody, I have good days and bad days. Like I'm known to be like pretty energetic. Sometimes it's the days that I don't take Suboxone that I really can't shut up. But that might be that undiagnosed ADD at hand there. But
yeah, and Cecilia Mayer on the chat box has an interesting point saying, she says, I was on Suboxone for a year and just plain buprenorphine for another year, and then decided to go off last year. And she says it really depends on the person in terms of tapering. That kind of answers Will's question as well.
Yeah, Cecilia just celebrated, was 1,000 days clean?
1,000 days, yeah.
1,000 days clean. She also just gave birth. Cecilia is one of our kind of founding core members here. She's a total badass. There she is. What's up, girl? Oh shit. So she's another. There's a lot of really awesome success stories kind of in and around us here, Doc. Yeah, 1,000 days, no joke. And I'm just so happy for truly, you know, it just really makes me think about all the people that are not just still here, but really thriving, almost maybe some of them even just beginning to really thrive. And I know what's ahead for them. And, you know, for me, I needed the Suboxone. If somebody doesn't, that's great. I don't know if I'll ever go off. Honestly, I don't know. I don't, there's nothing about my life that, well, I shouldn't say nothing. There's things I want to work on before that. It's just not something I dedicate a lot of thought to, but gosh, again, in the interest of full disclosure, it is from fear. I am afraid to be that kid that walked into your office in, I don't 2009, whenever the hell it was. It was a long time ago. I'm really afraid, truly afraid to be that guy again. Because I'm afraid that he lives in there, even though I don't think he does. I'm afraid he's still in there. So if I take my Suboxone every morning, I'm okay with that. I hope my friends in here are okay with that. It's not something that I feel that needs changing right away. But let's get into some more questions. That great, really terrific question, Will.
All right. Next question is from Janine.
Hello. I'm also going to throw a congratulations to Cecilia. That is amazing. 1,000 days, like incredible. But this kind of question just sort of came about as like a wonder twin between what Josh and Will was saying. Do you find that those that maybe do get diagnosed as neurodivergent with like ADHD or whatever dopamine deficient thing they have, if they get the diagnosis and even receive therapy to figure out alternative ways to cope with just being neurodivergent in this kind of society that we're in, do they have a higher rate of going off of Suboxone because they're finding that their coping skills and the way that they attack life is a little bit different and they're able to cope better and have that dopamine reception?
Yeah, well, I think in terms of the actual mechanism of addiction and dependency, it's multifaceted. And because of that, it really depends on the person. Yeah, maybe they have ADHD that made them start to use drugs. And there is, I think there was a psychiatric journal that had some study that said that 80% of people with undiagnosed ADHD tend to be dabbling in drugs at some point in their lives. So there is a connection there. In terms of actually getting off the Suboxone when they have this neurogenic conditions, it varies tremendously. Yes, if all the other aspects of their lives, like I said, it's multifaceted, but if they are able to take care of other aspects of their life that led to their addiction, then there's a much better chance that they can stay off the Suboxone or get off the Suboxone, and go back to not taking anything. It really varies. I don't think there are any real, there is no real data in terms of what percentage of people actually are able to do that. But I think it is possible. It's very possible. But there may be some other mitigating factors that interfere with that.
No, that totally makes sense. And not to say that like anyone has to go off. It was just very, yes, this has been an incredible conversation. I'm so glad you were a guest here, and I really hope other people check it out too. And that's all I'm going to say. I'm muting now.
Thank you.
Terrific questions. And you guys always have I knew it was going to be good. You guys always have the best stuff to say. And if I could just, usually don't talk this much, but I feel like such a personal connection with the doctor. ADHD is something I've been told by people I have, certainly in the last 10 years. But what's funny to me, it's like, if I'm comfortable with a group, I get like excited when I talk, but I love to listen to, I really like hearing people speak, and I'll ask them questions about it. But the more we talk and the more I read about addiction, I would always tell Rob of how heroin rounded off every edge. But God, just right now thinking of how heroin would zero in my focus in a way that was not normal to me. And we had just done a speech with Odd Squad. It was these cops in Vancouver who were doing a bunch of addiction outreach stuff, and they had asked me about like missing drugs in terms of creativity. And that was one of the main things that served my creative spirit well. But this version of me now, in a lot of ways, I think I'm able to zero in and treat it like work in a good way more than I was ever able to in my young life. But drugs certainly, not when I say rounded off every edge, one of the major ones was some of those feelings of not focusing on 12 things at once and nothing gets done. Heroin would take me in and focus like that. But I do think that's something, maybe that's also part of wanting to stay on Suboxone for me. Maybe it's, I found something that works. Again, I always talk about liking myself. Well, I like that I can focus enough, Rob. I know I'm not the best focuser, but I can focus enough. And yeah, I get through. I just wanted to say that. Janine, what a terrific question. No surprise, but you guys just have the best questions. I appreciate these questions. Really, really terrific.
We've the next hand that we have raised is from Tamara.
My wife.
Hi.
Hi.
It's the wife. Josh knows how much I don't like speaking on these things. It makes me super nervous, and my heart has been beating for an hour now because I just wanted to come on and say thank you.
Oh,
I'm gonna I know you say, like, and I always tell Josh this too, he doesn't give himself enough credit. And so, like, Josh, you got to give yourself more credit. You've done all the work, and we've supported you. And Nan can think all she wants, 92-year-old Pam, that I did it because that's the only thing she really likes me for. But anyway, that's but I just wanted to say, Dr. Ramaswamy, you have been such a pillar in our life and our relationship. And we wouldn't be here without you. And thank you for believing in him and, giving him that trust. Stop, Josh. Making me
why do you get off of you? Go away. What are you doing?
But yeah, I think we've only met once. And I think that's like 13, 14 years ago or something like that when I brought him to the doctor one day. And I just don't even know what to say. You mean so much to us and our family, and I
Thank
love
you.
you for that. Thank you. No questions. I just wanted to say that.
Love it.
In 5
Love
minutes.
it.
That was really sweet. I have a feeling it makes the doctor like really uncomfortable too,
No,
which is
no.
hilarious. I'm like crying over here. That was really nice. Yeah, Doc, I don't know if you can tell the people that are close to me in my life hold you in very high regard, but again, and I appreciate your kind of very clinical explanation of things, but there's obviously like a much deeper component to it than that, because if it was just clinical, then Cutler's program would have worked, or the methadone program would have worked, or the countless rehabs, and those rehabs would have worked if I did it. I know that I'm willing to absorb the responsibility that it was on me that I didn't do it, but I don't know, one rehab, I wasn't allowed to watch movies, and I just couldn't understand why. It's like, well, I'm here suffering already. Why can't I just have these movies? Or what, I just needed some kindness, and you provided like the right level of like stern faith and really like respect for me as a person. Maybe, I didn't need everything kind of spoon fed to me. There was a faith component on your end, like you talked about, like having some faith and not micromanaging every little thing. Well, I didn't want to let you down. And that, I know I've mentioned that a few times, but that was a big component to me finally putting this together, because it took a long time, man. It was many attempts, too many to remember. I can't even remember just how many attempts, but it finally landed with you. Or, if you were a different guy, you would have booted me off the program for peeing dirty, and you didn't. And that was a big deal. And I don't think it was my first time peeing dirty. I think there's a few times, but I don't want to get you in trouble. But okay, is there other, I know we're getting towards the end here.
Yeah, we are getting towards the end. We have one more question from our 1,000-day warrior, and then I've got a final question for you.
Awesome.
Yeah. Hey, I just want to say sorry I was late, but thank you so much. It's been awesome what I've already heard. I know, like, I've talked a little bit about my story, but like it took me many, many years to finally come to the point where I had no other options, because I was always taught that and Suboxone and methadone was just exchanging one drug for another, like you've heard before. And it got to the point where like I could not get past 3 months. Like I would white knuckle it until 3 months and then I'd fall off. And it took me years to finally I really got bad in 2017, and it took me 3 years of just like, because at that point it wasn't fun anymore. It really wasn't, like dealing with overdoses and losing my child to DSS and just like everything. Like the shame that Josh brought up, there was a lot of shame. I even had people in an NA meeting tell me I did not deserve my chip because of the fact that I was on Suboxone. And
I'm sure.
like I just want to say thank you again for everything that you've done for Josh and everything we've I am really grateful. And I ended up having to come off because when I found out I was pregnant with my daughter, I started actually getting really sick from the medication. Otherwise, I would have stayed on it, because why try and fix something or change something if it's not broken? But anyway, I just wanted to say thank you again so much for what you guys did tonight. And there's a lot of great stuff that came up. So thank you.
No, and thank you, Cecilia. We love you so much, as you know. So just, have you heard, is that something, Doc, that happens with women when they get pregnant, that the medication kind of reacts in a funky way and then they have to come off, and then
Yeah, it can happen. Before that, let me kind of piggyback on something that Cecilia said about she came to a point where it was not fun anymore. And in fact, most of the people that have come to see me for Suboxone, they were not having fun anymore. they were at a point, I mean, the party days were gone. They were not having fun. They were just taking the drugs not to feel sick. And that was the only thing that prevented the withdrawal, and they had to take the opioids just not to feel sick. So they were not having fun anymore, and that is another motivation factor for them in terms of uh, uh, being compliant with Suboxone. Coming back to the pregnancy question, yeah, there have been studies in pregnant women. There have been a lot of studies using methadone. So methadone is actually the drug of choice for MAT in pregnant women. And as far as Suboxone goes, actually Subutex, which is the buprenorphine without the naloxone, is used in pregnant women. So it can still be used in pregnant women. And yes, with pregnancy, the side effect is unpredictable. Some people exhibit side effects, some don't. I've had a handful of women that got pregnant while they were on a Suboxone program, whom I had to transition to Subutex, and they underwent their pregnancy normally. And of course, the babies, because they were on Subutex, the babies had to be watched for opioid withdrawals. So they were in the neonatal ICU for maybe a couple of more days. But they all had healthy babies, and the babies did just fine.
All right.
Well, Doc,
wow.
I'm curious. Rob, can I?
Yeah, go
I
ahead.
know we're running out of time. My notes here look similar to my notes at Drumeo with just demon
They do.
faces and it's scribbled everywhere. Doc, why? So it kind of answered the question here, but before that story, I was going to ask why Subutex because I'll tell you, the Suboxone with the naloxone with the blocker, that's why I didn't abuse it. That's the only reason early on that I didn't abuse it. Why do they make Subutex if it can be abused?
Yeah, well, I think Subutex is pure buprenorphine. It can be abused if you give it. The naloxone is really to prevent the euphoria that the buprenorphine can have. Buprenorphine, its main job is to occupy the opioid receptors, the advancing army and all that, and create a sense of saturation of the receptors. And sometimes people take certain examples where they take it to get high, and they can get high, but the naloxone acts as a check and balance in terms of getting high. There are people that actually inject Suboxone, and the naloxone prevents that from happening. And if you take Suboxone with opioids or with heroin, it's going to precipitate a withdrawal. So the naloxone is kind of more of a safety net. People taking Subutex do, as well as people taking Suboxone, but it's just an added layer of safety.
Yeah, but I'm curious, why did they even make Subutex? Like, if you had it kind of figured out with Suboxone, it figures like that was my question before. If the answer could have been it's for pregnant women, and I would have said, oh, okay, because that story was like, oh, well, that seemed to work for them. But if I had been put on Subutex, I would have never been able to control the urge to. I mean, there was early times on Suboxone that I tried. I tried to take all of it. I tried, and I've mixed it with heroin and got led right into like day 2 withdrawal. Never did that again. Again, late to the party. I had to learn the hard way, and it was brutal.
Yeah. Suboxone is certainly a superior medication compared to
that's what I feel. That's what I think. But I have no experience with Subutex. I've only been on Suboxone, but for me, the blocker was just paramount. It was so important, especially early on. And I'm not proud of this, but yeah, if they had given me Subutex, again, like the methadone, it would have been gone in a day and a half or 2 days, whatever. I would have abused it. But with the Suboxone, the real beauty was that it's your own safety net. And in the beginning, I was on a super high dose. I imagine if I took that dose now, I probably would feel the euphoria and high. I'm not into being high. I don't drink caffeine because I'm afraid of my heart. I've turned into a big weenie, but I'm just not interested in being high. But again, I've always been curious, and me and Rob have like discussed this privately. Why do they even make Subutex? But I'm sure it has its implications or its spots where it's useful, like with the pregnancy. But yeah, it just seemed odd because I didn't. Rob asked me that, and I didn't have an answer. I said, you know, if we get in a room with the makers of Suboxone, we could ask them because I don't know because Suboxone, the blocking agent is just paramount. It's really important. I know we're like out of time. Is there one more question?
That's all right.
What do you?
No, I wanted to give the doctor a chance to make kind of a final statement, and I'll say that between tonight, the recording that we have tonight will go up on our Patreon page for free for everybody to access and review, and then of course we cut up clips for social media, and so between those avenues, thousands of people will hear what you have to say. Given that, I wanted, if you were able to talk to somebody that is still in active addiction and wanting to break free of it, what would you tell them in terms of general advice and finding a provider they can work with?
Yeah. Well, the general advice is recognize the fact that you have a problem and acknowledge the fact that you want to get treated for it and get better. Finding a provider, there are several providers that deal with Suboxone. I think Suboxone site has a website, and so has the SAMHSA website, which is the Mental Health Administration website. They will have people, and now, as I said, you don't have to be certified to prescribe Suboxone. If you have a good relationship with your provider and the provider is willing to prescribe Suboxone, any provider, any nurse practitioner, physician assistant, or a physician without Suboxone certification is now allowed by the DEA to prescribe Suboxone. And that is really to expand the network of providers available to prescribe this. Now, finding a provider might be a challenge, but there are several providers that would be willing to take you on. And there are a lot of addiction medicine centers as well that hospitals run.
Okay. We had one other comment in the chat, and we can't get to it because we've literally run out of time. But I wanted to remind everybody that we do have a Discord that's available that people can continue the conversation in the Discord. And it's about growing a community in the Discord. And this is kind of like, you know, what you see here in the Zoom is kind of like the tip of the iceberg, and the rest of it is all the support of infrastructure that we have behind it. And if you're in the chat, Devin, just put the Discord link up for that. And I know we have a few new people in here tonight, and people that will either hear this recording or the clips that we put out. I would tell you that if you have a story to share, please go to our website, drumsetconfessional.com, and share your story. You'd be amazed at what that can do for a community. And I'm going to give Josh the last word before I say one final thing to you, Doctor. Thank you for saving my friend's life. Honestly and truly. You know, I've gotten to know him a lot better in the last year. And I know the world would be a lesser place without Josh. You know, we just got done filming in Vancouver at Drumeo, and one of the people that was a driving force behind getting him to go there started that driving force 8 years ago. And the entire time I'm in the control room, I'm watching her as Josh is playing, because I'm just seeing the pure joy that he evokes out of people. And I see him do that when he plays. I see them do that when he talks to people. I see them do that when I put him in front of an audience of people. And I think we're all better off that Josh is happy and healthy and doing well. And again, thank you for saving my friend's life.
Oh God. I just got
Josh, you have the last
crying.
word.
Christmas. You guys are making me cry. Well, obviously, thank you, Doc, so much. I do want to say to the group, I know we said this at the last meeting. At the next meeting, we're going to dedicate a portion of this, which this is super important to me, to our group sharing. We want to hear from the Cecilias, from the Wills. We want to hear from you guys. We want to hear from people that have something they want to say. I mean, that's really the lifeblood of community. I just think today I could sit here and probably talk to the doc for hours and hours and on end. And I just thought it was worthy. Like I thought about it at around 8 and I was like, man, what an opportunity to have the doctor bless us with his time. This man has just years and years and years of experience in this world. So I just wanted to take advantage of that. And there were some such terrific questions coming in. But at the next meeting, it's going to be like split up into 3 things. It's going to be like speaker, questions to the speaker, and then they can kind of both exist, questions to the speaker. But I want to hear from you guys. And, you know, this was only our 3rd one and we're kind of really finding our way still, but this was just, I always have lofty expectations and this really exceeded it. Hopefully we can edit it out, all my crying, because Tammy and Rob is really touching. And then that nice note that came up. But yeah, what a really thrilling experience, Doc. You know, for me, pretty much anytime we talk, Dr. Ramaswamy, anytime that you're involved in my life in any kind of way, even just our appointments, it's always a powerful reminder to me of where I've been and where I've come. And I think for me, that's a really healthy thing. And I just can't thank you enough. That's about it. I know we've gone over. Thank you for your time. This is a lot of time for you, man. You're a busy man. You know, he's not just a
My
doctor.
pleasure.
He's got a family. Yeah. What a terrific, terrific, terrific meeting. And I just can't thank you enough. And I don't know. I'll see you in a few days. I got to book an
Okay.
appointment. So I'll see you in
Right.
a few days.
Bye, everyone. Bye.
Later.
We'll close with the words of Janine from the chat, who says, "We all thank you, Doc. This group exists because you saved our Josh. Thank you."
Oh God, I've cried enough. Goodbye. I'm leaving.
Okay.
Thank you,
Bye.
guys.
Bye-bye.
Good night.
Good night.